Developing local vaccines to address diseases prevalent in Africa and Nigeria by extension has been a subject of discourse over the years. And more worrisome is that most developing countries like Nigeria still depend largely on imported vaccines, which may not address all the health needs of citizens. But some glimpse of hope was shared by the Minister of Health and Social Development at this media engagement.
In November, we launched a task force to start working towards a Lassa fever vaccine development in Nigeria, chaired by the NCDC, the NAFDAC DG, our development partners, to start conducting studies to understand the epidemiology of Lassa fever, because we know there are candidate vaccines. So that when the vaccines are developed, they are manufactured in Nigeria, that they are safe and effective, and they're deployed in Nigeria. That task force is doing its work currently, so that in the future, when we have vaccines, people can take the vaccines against Lassa fever, that we don't have to lose people every year, lose health workers, unfortunately, from this virus.
On medical tourism that has impacted negatively on the nation's health system and the economy generally, the minister announced that a $1 billion MOU has been signed to expand healthcare services through local production of pharmaceutical drugs and engagement of more nurses and doctors, especially in primary health centers.
It's money to be available for investors and participants in the healthcare value chain, so that we can manufacture, produce materials here that will be useful, that will be effective, but also retain the economic value and create jobs for Nigerians. So health is not only a consumption sector, but it can also be a productive sector. And I think that direction, consistent with the President's direction and his agenda.
Government has assured Nigerians that it will prioritize local healthcare for citizens by making drugs more affordable and create specialized health centers in geopolitical zones of the country to cater to specialized health emergencies.